Jack of the Naturopath. Thanks for coming back. Let's talk about the dosages of Candida products. By now, if you've been looking at this channel, you'll be quite familiar with the kind of work that I've been doing now for quite a long time. Working with patients, primarily with yeast infections, but also small intestinal bowel issues, bacterial problems, constipation, gallbladder problems, so many different things. So this was basically my life's work for 30 plus years. The products came, more towards the end of the work that I did based on experience and understanding, and working with many companies. And one thing I've come to realize, one size does not fit all. Okay? Now, I know what size Levi's I like to wear, the black Levi's that I usually wear, right? It's a 33 centimeter waist. It's a particular size, so I can go down to a shop here and I can say, right, I want these jeans, and then bang, I got these jeans at that size. And that fits me. Now, if I were to have jeans for sale on this YouTube channel, or shirts or whatever, and if I just created one size, how many people do you think would like that? Ain't gonna happen, okay? Because everyone's got a different size. And it's the same when it comes to taking a tablet or taking a capsule. One size does not fit all. It has to be tailored to suit that person, and you will know what suits you in terms of the jeans you wear or the top that you wear or whatever. You put it on, it's no good, it's too small or it's too big, you'll know straight away. It's a little bit different when you're taking a dietary supplement. Right, so let's just talk a little bit there and explain the concepts that I sort of work with patients with when it comes to dosages. One reason I believe I've had a lot of success, and again, I'm not flying tickets or waving flags or got big egos, but I've had tremendous success with many patients. I've taught many naturopaths in Australia and New Zealand on how to successfully work with people with a lot of gut problems, because you need to tailor and suit the dosage for that patient, and this is how you're going to do it. So let's talk about that now, okay? When you look at the Candida Remove formula, probably the most powerful product that I've made to date, you need to be careful, all right? So I always, that was 4 times I said always, I'll say it one more time, always start low, all right? You're not going to take Candida Remove and put 12 tablets in your hand and swallow them all, but some patients I know have done that in the past. And I basically growl at those people. I get annoyed with them when they were patients. Yes, I have actually fired some patients for being naughty people or not trying to really listen when I'm talking to them and they're in my consulting room, but throwing caution to the wind and doing silly things. So if you're a chronic person, if you've had problems for a long time, let's say you've had issues for say 5 years plus, it's not a great idea to take a brand new dietary supplement off the bat at a high dose. There's no difference with that, with not understanding how to drive a motor vehicle and then getting into a Lamborghini and saying, look, I'm going to be the best. And I've seen enough YouTube videos, I'm sure you have, of people hopping into Lambos and wrapping around a telegraph pole as they go up the road, okay? That's just stupidity. There's no need to do that. When you've got power, you need to understand how to use the power wisely. And a Candida Remove is a powerful product. So, in saying all that, you start with 1 tablet a day. But if you've been chronically sick for 10 to 20 years, and you can't poop, for example, except once a week, you've had serious constipation half your life, or you've been on multiple rounds of antibiotics, you've got a long history of taking many pharmaceutical medications, etc., etc., etc. You know what I'm saying at, like the seriously chronic person. Those people may want to even start with the Candida Remove tablet, cutting it in 3 or 4 pieces and taking 1/4 of a tablet. Now, to mitigate side effects, well, not side effects, but aggravations, if you're a seriously sick person, you will always take that Candida Remove with a snack or a bit of food. With experience, or if you're a milder case, you can get away with taking it well away from food, but not if you're chronically seriously sick. In many of those cases, you'll be under the supervision probably of a medical doctor anyway. But on my experience, a lot of people who will self-medicate because they get sick of going to doctors time and time again and just basically getting the prescription shuffled around. That's all they get. So they end up ditching the doctor and doctoring themselves. So you need to be very careful in that case if you're taking, say, 5 or 6 pharmaceutical drugs and you want to incorporate Candida, I recommend you do that under the supervision of a licensed naturopath or medical doctor. Unless you are a person who studied medicine or understands these things. That's a seriously sick person. Let's talk about the average kind of person who I used to see. Someone who's been sick maybe for 6 months, 18 months, 1 or 2 years, on average. There is no average. So I would always start that patient on 1 tablet a day. But sometimes I'd have a patient sitting in, we used to have a chair there, and they'd pull out a bag of supplements they'd been taking, for example, oregano oil, or they've been on probiotics for a year, or they're quite experienced supplement taker. Generally, they can take 1 per day, or even 1 remove per day, twice per day, without too much problem. So it's something you need to feel the water with. There's no way possible for me to say that all you guys out there need this dose and that's it. That's what the amateurs do. Amateurs will give people basically a dosage guidance, a range for the dosage, and say take between 1 to 2 or 3 tablets 1, 2 or 3 times per day. And that's a very loose kind of way of prescribing. Supplements work well in the digestive system when there's food in there. They always tend to work better, particularly the ones like Candida Remove. Probiotics also work quite well with food, regardless of what people say, especially if you put them in a delayed, time release capsule. So back to Remove, I would recommend 1 per day for 2 to 3 days, and then if that's okay, then you can probably step it up to 1 twice per day after that, and then within a week or 2 you're probably on 3 per day. You can take Candida Remove from anywhere from a quarter tablet up to 12 tablets a day. I've had some patients take 12 a day for a few months that really cleaned up the digestive system from seriously big problem. It also depends on your toughness, your mental toughness. Can you handle perhaps a bit of a reaction if you take too much? Can you handle a headache? Can you handle a sick feeling? That will only happen if you push yourself too hard. Now, by going to the gym, if you push yourself too hard, well, you're going to have a sore butt, you're going to have a sore legs, sore arms. I mean, you know that. But the degree of the pain depends on the degree of your attitude too, and how you are at the gym. If intelligent people will take it easy for the first 4 to 6 weeks and gradually break in, train harder and harder, and then kapow, they're into it. They're training. Supplement takers are the same. Start slow, build that up, work out what works for you, what suits you well, and work out what's overstepping the mark, or overtraining in this case, okay? So most people, I won't say all, but most patients I've seen when I did see patients, when they were taking the Candida products, would easily get away with 2 to 3 tablets per day for 6 weeks, 8 weeks, 12 weeks, no problem. I would say that with at least 60-70% of people. And the rest were made up of cases, with varying complexity, from relatively complex up to seriously complicated cases. And those people sometimes would see me weekly. We'd have a Skype session once per week, and we'd talk about things. And often I found that something would get in the way. There'd be some family problems, or a person would lose their job, or they get fired, or they have a separation, or there's some big emotional crisis happened. And then, of course, the supplements, we would drop the dosages right back. We wouldn't sustain those dosages. So, when a fork comes in the road, sometimes you've got to take a detour. You've got to stop, back up, and think, what am I going to do at this point? So if you've been sick for a long time and you're trying to supplement, you need to work the supplements also around your lifestyle and your diet. So it all depends on what you eat, how much you eat, all those kind of things. So if you want to summarize Candida Remove, I would say start with 1 per day for 3 days on average. And if that's okay, then you can take 1 twice per day for the following 3 days. And then you should be on 1 with each meal. So breakfast and lunch are usually the two better dosages I like people to take Remove with. So eventually then you can take 1 breakfast, lunch and dinner. And again, if you want to be cautious and you want to step it up, you could cut a tablet in half and take 1.5, 1. So sometimes I'd get a piece of paper, and I encourage you to do that, and just put Monday, Tuesday, Wednesday, Thursday, Friday, all those days, just put tung, and then put your dosage down there. I'm going to take 1 on Monday, I'm going to take 1 on Tuesday, I'm going to take 1 on Wednesday. and I'm just going to do that for 3 days, and I'm going to stop and see how I feel. That's being cautious and doing it correctly. And then if that's okay, then you could go Monday, maybe 1.5 or 2, 1 for breakfast, 1 with lunch. Or you could do 1 for breakfast and a half with lunch if you want to be a bit more cautious. So it's totally up to you. But I can assure you, there's no toxic ingredients in Candida Remove. It's not an addictive product. You won't get like addicted to it. It hasn't got methamphetamine or drugs or pharmaceuticals or nothing in it. I get the weirdest emails you wouldn't believe. Some people tell me there's pharmaceuticals mixed through it, antibiotics and things. But what the hell would I do that for? So you're in safe hands. You just need to work out the dosage that's correct for you. And the main problem I found with people is in the beginning stages of starting the supplement. The first usually 2 to 3 weeks for many people is the problematic one, when they don't really know what they're doing. Think back when you bought that Harley Davidson that you've got now, or that car or whatever it is. The first few weeks you were on it, it was pretty scary, wasn't it? You didn't really know exactly what to do or what your limits were or what you could get away with in that car. But eventually, after a few long trips and driving it and whatever it was, you felt more comfortable, and then within a few months it was no problem at all. Candida Remove is exactly the same. Okay, it's a powerful vehicle. You need to know how to manipulate the speed and all those kind of things, and you can do that with just a tiny little bit of intelligence and a lot of common sense. That's all you really need. So don't ask me for what dosage would you recommend for me. It's something you need to do yourself, like try those jeans on to see if they fit, or hop in that car and work out how far you can push that gas pedal down, right? So you know what it's like with a gas pedal. It's quite nice to go fast, but then you've got to stop at the end of the road, and the supplements are no different. It's nice to take them, but then what about the following day or the day after when you're sitting there in the bathroom? Is he going to have a problem? So, but you shouldn't if you're cautious. All right? Candida Restore is a little bit different. It's a capsule, it's not a tablet. It's in a particular type of time release capsule. I like people to take Candida Restore twice per day, morning and before bed. But I know a lot of people will take that capsule 3 times a day, breakfast, lunch and dinner, and that's perfectly fine too. The dosages for Restore are pretty similar to Remove, except you're not going to use as much. You don't have to manipulate the dosage up and down as much as you do the Remove, because the Remove does most of the cleaning and the digging in there and getting all the crap out of the gut. Whereas the Restore does what it says. It restores the digestive system. So this is something you're going to do for several months. The last supplement generally you take is a probiotic enzyme, which is Restore. Remove's more for the heavy duty work, getting things sorted, and they both work really well together. Is a multivitamin. So that's the one again, 1 to 2 per day is perfectly fine. Generally again with breakfast, lunch or dinner, one of those 3 meals. Start with 1 a day, you can end up with 2 per day. They're a little bit chunky, you can crush them up and mix them in with food, no problem at all as well. So I hope that gives you a bit of insight into the conflicting stories, that I keep seeing about the Candida products. How many do I take? Do I take 10 a day? Do I take 2 a day? So just count on anywhere between a quarter of a tablet up to 12. Now you won't be taking 12. 12 is something you do under the guidance of somebody, generally, and it's for seriously sick people with like very high blastocystis problems, or people who just want to get a breakthrough. They just want to. It's a bit like taking that car on the racetrack and pushing through the fear barrier and realizing that you can do a hell of a lot more than you thought you were capable of. But most people will never go on a racetrack with a car, like most people will never take 12 Candida Remove per day. So top end dosage for you, I think realistically for most people anywhere between 4 to 6 per day for short bursts of 2 to 3 weeks. I'll have to do another video showing you different types of protocols which I've worked out for taking Candida Remove, and I might do that in the video after this to show you, for example, the 242 protocol and various other ones that I've worked out. So I hope you got a bit of information out of this video. Thanks for tuning in.